Let's talk about xylazine or tranq. Xylazine is a tranquilizer used for sedation and muscle relaxation in veterinary medicine. It's often referred to as a horse anesthetic. It's an emerging adulterant in illicit drugs, and we're seeing xylazine in a growing number of overdose deaths. In 2021, the Philadelphia Department of Public Health reported that 91% of drugs purported as heroin or fentanyl actually had xylazine in it. Xylazine can be injected, snorted, ingested, and smoked. The powder is being used in drugs as a cutting agent to increase bulk. It's not a controlled substance, it's relatively cheap, and then it can potentiate the effects of opioids, amplifying the already devastating opioid epidemic. It can also decrease the adverse effects of stimulants. Xylazine is a critical and emerging public health concern, associated with CNS depression, significant cardiovascular effects, skin ulcers, which is a risk for bacteremia, sepsis, endocarditis, and limb amputations. I'll mention that IVDA or IV drug abuse in general poses a risk for these issues. There's currently no FDA-approved reversal agent for humans for xylazine. Treatment is supportive care, so airway management, fluids, vasopressors. I will mention that a reversal agent actually exists. It's called adipomeprazole or antocidan. It's an alpha-2 antagonist approved for the reversal of dexmedetomidine and medetomidine in animals. I will also mention that there's some mixed and inconsistent literature showing that Narcan could possibly reverse clonidine overdose, which is another alpha agonist. So xylazine is in the drug class called alpha-2 agonists. Some other examples of alpha-2 agonists are dexmedetomidine or Precedex. We use it in the hospital for ICU sedation and then also procedural sedation. Another one is lofexidine or Lucamyra. It's somewhat of a new one. It was approved in 2019 to help with the physical symptoms associated with opioid withdrawal. Tizanidine is another one. It's used for spasticity, and guanfacine is also another one used for ADHD. Those don't have as much of an effect on blood pressure. Clonidine is another alpha-2 agonist. It's used for like a handful of things. It's generally reserved last line for hypertension or high blood pressure. It can also be used for opioid withdrawal and ADHD, and then also sometimes vasomotor symptoms in menopause. Or like hot flashes, but it's not used super often. Xylazine is a structural analog of clonidine. It has a thiazine ring instead of an imidazoline ring. Alpha-2 agonists act on alpha-2 receptors. Alpha-2 receptors are found on the presynaptic and postsynaptic neuron and central and peripheral nervous systems. Xylazine acts on the presynaptic alpha-2 receptor. Alpha-2 is an autoreceptor. Autoreceptors serve as part of a negative feedback loop in signal transduction. When these alpha-2 receptors are activated, it causes a decrease in norepinephrine release, and thus a decrease in sympathetic output. So we see hypotension, bradycardia, sedation, and muscle relaxation. Let's talk pharmacokinetics for my pharmacist followers. Xylazine is quickly absorbed and then has a high volume of distribution due to its lipophilicity. This is not good because remember, if a drug is really lipophilic, has a high volume of distribution, it's not really readily removed by dialysis. Xylazine is metabolized by the YOUR.FAV.PHARMACIST system and then has an elimination half-life of about 23 to 50 minutes. Toxicity and death occurs between 40 and 2400 milligrams of xylazine, with fatal plasma concentrations ranging from trace amounts of xylazine to 16 milligrams per liter. There's a significant overlap between fatal and non-fatal doses. The primary metabolite is 2,6-xylidine or 2,6-dimethylanolin. This metabolite has been shown to be carcinogenic. What I thought was interesting is that lidocaine has the same metabolite. We can get this metabolite in a couple different ways through amide hydrolysis. If you use illicit substances, it is important to test what you're ingesting. It's important to test every single amount that you're ingesting. See, with the chocolate chip cookie effect, this little chunk doesn't really have fentanyl in it, but another chunk you can be blasted out with fentanyl. You can buy test strips for xylazine and fentanyl online, and they're relatively easy to use. I'll also mention that pharmacists can prescribe Narcan in many states, including my state, Indiana. When it's prescribed, we can bill insurance. Most commercial plans cover Narcan, and with Medicaid, it's free. Let me know what other drugs you guys want me to talk about.